Iron deficiency anemia is a condition where there's not enough iron to maintain normal red blood cell production. This leads to low hemoglobin levels in the blood, causing hypoxia in tissues and resulting in various systemic symptoms. Key features of iron deficiency anemia include hemoglobin below 13 grams per deciliter in men, below 12 grams per deciliter in women, and below 11 grams per deciliter in pregnant women. Low serum ferritin, microcytic, hyperchromic red cells. Iron deficiency anemia affects about 2 billion people worldwide and is more common in women, especially during menstruation, pregnancy, and lactation. In children, due to high iron demands during rapid growth and limited dietary intake. In pregnant women, because of increased iron needs to support fetal development and increased blood volume. In developing countries, it is often due to poor diet, parasitic infections, and malnutrition. However, in developed countries, it's more common in women of reproductive age and the elderly. Causes of iron deficiency anemia include inadequate iron intake as seen in populations with poor diets, such as vegans, malabsorption in conditions like celiac disease, gastric surgery, or inflammatory bowel disease, may be due to increased iron requirements during pregnancy, lactation, rapid growth in infants and children, and heavy menstrual bleeding. Chronic blood loss is the most common cause in adults. This includes gastrointestinal bleeding from ulcers, colorectal cancer, or hemorrhoids. It may also result from urinary tract bleeding from renal disorders or bladder cancer, and from trauma or surgery. There are 3 stages of clinical presentation of iron deficiency anemia: pre-latent, latent, and frank stages. In pre-latent stage, iron stores are depleted, but there's no anemia yet. Symptoms may include mild fatigue. Laboratory findings at this stage include decreased ferritin levels. In latent stage, further depletion of iron stores occurs, but hemoglobin levels are still normal. Symptoms like fatigue, weakness, pallor, decreased exercise tolerance, cravings for non-nutritive substances like dirt or ice, and restless leg syndrome may appear. Laboratory findings show low ferritin and normal hemoglobin levels, approaching the lower limit. In frank or full anemia stage, hemoglobin levels fall below normal. Symptoms become more severe. These include severe fatigue and weakness, spoon-shaped nails, smooth, swollen, sore tongue, cracks in the corners of the mouth, dyspnea on exertion, tachycardia especially during activity, headaches, dizziness, and cold extremities. In children, iron deficiency may lead to irritability and decreased concentration or cognitive function. Diagnostic features include low hemoglobin levels. Low ferritin levels are the most reliable indicator of iron deficiency. Serum iron levels are typically low, and total iron binding capacity, a measure of the total capacity of transferrin to bind iron, is usually elevated. Transferrin saturation is often below 20%. Soluble transferrin receptor levels are elevated due to increased production when iron stores are low. Reticulocyte hemoglobin content can be used for early detection of iron deficiency. Microcytic, hyperchromic red cells on blood film examination are characteristic. The goal of treatment is to restore normal iron levels and improve hemoglobin. Oral iron supplementation with ferrous sulfate is commonly used, with a typical dose of 100 to 200 milligrams of elemental iron per day. Other forms include ferrous gluconate and ferrous fumarate. Side effects may include constipation, nausea, and gastrointestinal discomfort. Treatment usually lasts for 3 to 6 months. Intravenous iron can be given when oral iron is not effective or tolerated, or in severe anemia. Common forms include iron dextran, iron sucrose, and ferric carboxymaltose. Blood transfusion may be necessary in severe cases, particularly when there are cardiac symptoms. Underlying causes of iron deficiency states, such as gastrointestinal bleeding or malabsorption, should be addressed. Prevention of iron deficiency anemia includes iron-rich foods such as meat, poultry, fish, legumes, fortified cereals, and dark leafy greens. Vitamin C-rich foods like citrus fruits and tomatoes can improve absorption. Avoid iron absorption inhibitors by reducing tea, coffee, and calcium intake. Pregnant women, young children, and those with heavy menstrual periods may benefit from iron supplements. Iron-fortified formula or iron supplementation for breastfed infants may be necessary after 6 months. Pregnant women and children should be screened regularly for iron deficiency anemia. In conclusion, iron deficiency anemia is widespread and preventable. If untreated, it can lead to significant health complications. Early detection and treatment can prevent these complications, improve quality of life, and promote long-term health.